Today our topic is accommodation in normal eye and accommodation in different refractive errors. And in this video, we will discuss that how this beautiful phenomenon which is called accommodation will work in a emmetropic eye, in a normal eye, right? And how this accommodation will work in different refractive errors like in myopia, in hypermetropia or in astigmatism. So now we will discuss that how accommodation will processed in a normal eye, in a emmetropic eye, right? You know that in emmetropic eye, all the light rays which are coming from the infinity are focused on the sensitive layer of macula or the retina, right? And how accommodation will work in emmetropia or in the normal eye. So in the normal eye, when we look at the far, when we look at the distance, the accommodation is totally relaxed, right? The crystalline lens is less globular, right? Accommodation is totally at rest position, right? And when a emmetropic eye or a normal eye will look at the near distance, right? If we write something, if we read something, if we're looking at our reading material, then the accommodation will exert, right? So we conclude that the accommodation will totally at rest at the distance if you look at the distance, and accommodation will exert when an emmetropic eye or a normal person, a person which is having visual acuity 6 by 6, when that person will look at the near distance, the accommodation will exert. The lens will be more globular, the lens will be more in thickness, the thickness of the lens will increases, right? The power of the lens will increases. That increase in the plus power of the crystalline lens is called accommodation. So I repeat, if we talk about the accommodation, the process of accommodation in emmetropia or in the normal eye, the accommodation at distance is totally at rest. The lens is less globular. The thickness of the lens is less, right? The power of the lens is less at the distance, right? And if you talk about when a emmetropic person or a normal person will look at the near, at the reading, then the process of accommodation will exert, right? The thickness of the lens will increases. The power of the crystalline lens, the plus power, I must say, the plus power of the lens will increases, right? So now we will discuss this precious process of accommodation in different refractive errors. So now we will learn that how the accommodation will exert, how the accommodation will processed in hypermetropia. And you know that if we learn about the definition of the hypermetropia, you know that the definition of the hypermetropia is if the light rays which are coming from infinity are focused behind the retina, behind the macula, and when the condition is when the accommodation is at rest, right? If the accommodation is at rest and the light rays which are coming from infinity are focused behind the retina, this condition is called hypermetropia. And now we will compare the process of accommodation with hypermetropia. We know that the light rays in hypermetropia are focused behind the retina, right? And the power of the eye is decreased, the power of the eye is less in hypermetropia. So if I say that in hypermetropia, the plus power is decreased, right? So now we will compare accommodation with hypermetropia, right? As we have discussed that if we talk about the definition of the hypermetropia, actually in hyperopic condition or in the hypermetropic condition, the power of the eye will decreased, right? The plus power of the eye, or you can say the plus power of the cornea or the plus power of the crystalline lens will decreased, right? This condition is called hypermetropia, right? And if we talk about this one, if we talk about accommodation, so in the process of accommodation, the plus power of the crystalline lens is increasing. So if I talk about the hypermetropia, the plus power is decreasing in the case of hypermetropia, and in the case of accommodation, the plus power is increasing. So now we will discuss the relationship, the intimate relationship you can say, or the romantic relationship you can say, between both of these processes, the accommodation and hypermetropia. So we have discussed plus power is decreasing in hypermetropia and increasing in accommodation. So we conclude that if a hyperopic patient is looking at the far distance and his or her accommodation is at rest, then distance would be blur. So to make that distance clear, the hyperopic patient will increase its plus power, because in hyperopic patient the plus power is decreased, right? So to increase that plus power, that patient of hyperopia will increase its refractive power. So it means in case of hypermetropia, the hyperopic patient will exert maximum accommodation. He will increase its plus power to compensate his vision, right? To clear his vision. To see clearly, he will use accommodation. He will exert accommodation, right? And when that patient will see at near distance, that hyperopic patient, I'm talking about the hyperopic patient, if that hyperopic patient will see at the near object, then he or she will require more and more plus power. So that's why this is the reason that in the case of hypermetropia, the hyperopic patient will face less difficulty at the distance because he is using accommodation. His plus power is decreased, but he uses accommodation. So the plus power of the eye, the plus power of the lens will increase to compensate that refractive error, which is called hypermetropia. But so as that hyperopic patient has already used his plus power at the distance, so when that hyperopic patient will see at the near object, then he or she will face difficulty, right, to read at the near object. So that's why, so here in the near object, in hyperopic condition, right, the patient will need more and more plus power, right? So this is the reason that in if we talk about the hyperopic patient will see far object somehow clearly, right, somehow clearly. And when that hyperopic patient will see at near object, then he or she will face difficulties in reading. So that's why in hyperopic patient, distance is somehow clear, but reading is not clear. So if I say, if a patient of hyperopia came in your clinic and asked for the eye test, then he or she will complain that he is fine, somehow fine at the distance, and but he or she is facing difficulty in reading. So that patient is of hypermetropia because he is using accommodation at distance. So that's why he is clear. His vision is fine. But when he or she will look at the near object, then he or she will require more and more accommodation, right? Which he has already used at distance, right? So now I hope it's clear regarding hypermetropia, and now we will discuss accommodation in myopic patient. So now we will discuss that how accommodation will work, how accommodation will process in the case of myopia, how accommodation will work in myopic patient. And you know that the myopic patient, or you can say myopia, if we define myopia, you can say the light rays which are coming from infinity are focused in front of the sensitive layer of the retina when the accommodation is at rest, right? So if our eye is at rest position, if our crystalline lens is at rest position, eye is not exerting accommodation, and light rays which are parallel light rays, I must say, which are coming from infinity are focused in front of the sensitive layer of the retina, that state of refraction is called myopia, right? So in myopia, in the case of myopia or in myopic patient, you know that the plus power is increased from the optimal power of the lens or the cornea, right? You know that the normal power of the eye is 58 point something, right? Different authors have different opinions, but we must say the total power of the eye, including cornea, which is 43 diopters, and lens, which is 15 diopters. So both of these powers are the total refractive power of the eye, which is 58 diopters, right? So the normal power of a normal eye is 58 diopters, and as we have discussed in case of hypermetropia, that 58 diopters of the power is decreased, the plus power is decreased in case of hypermetropia. And now we are discussing about the myopia, and in the case of myopia, the plus power is increased. Suppose If the patient has myopia of -2 diopters, it means his or her power of the eye is increased to 60 diopters. If the normal power is 58 and the current power of the eye is 60 diopters, then it means we have 60 diopters of the power, and the power of the eye is increasing from 58 to 60 diopters. So that condition is called myopia. So in hyperopia, the plus power is decreasing. So we will add plus power in the case of hypermetropia, right? To clear our vision. And in case of myopia, because the power of the eye, the plus power of the eye is increased, so we will add minus power to decrease that plus power, right? So if we talk about the process of accommodation in myopia, so you have to keep it in mind that myopic patient, right? The myopic patient can never exert accommodation. You have to keep it in mind that myopic patient will never exert accommodation. And if we compare hyperopia with myopia, in case of hypermetropia, the hypermetropic patient will exert accommodation every time, right? If he or she is sleeping, that I can say he is or she is not using accommodation, but the hyperopic patient will use exert accommodation every time, right? And in the case of myopia, the myopic patient will never use accommodation, because the logic behind that is, in the case of myopia, the plus power is already increased. So the eye is nothing to do with to increase the plus power of the eye, because the plus power is already increased. The light rays are already in front of the retina, right? So myopic patient can never use accommodation, right? And hyperopic patient will always exert accommodation to see clearly. And the myopic patient will come in your clinic with the complaint that he or she is facing difficulties to looking at the distance, right? Because myopic patient required, or a normal person required, 58 diopters of the power, but in myopia that plus power is increased. And the problem is, the myopic eye can never reduce that plus power itself. So we need external lenses, we need spectacles to reduce that plus power, and that glasses are in minus power, the concave lenses. And one thing you have to keep it in mind, that if a myopic patient will come in your clinic, then he or she will complain of blurriness at the distance, right? And he or she will not complain at near object, at reading or studying, right? Because there is a logic behind that. You know that the at the distance, right, the plus power of the myopic eye is increased, and the eye do not have any ability to decrease that plus power, right? Eye has ability, I repeat, eye has ability to increase the plus power in the sense of accommodation, in terms of accommodation, right? But the eye do not have any ability, the eye do not have any capability, the eye do not have any property to decrease that plus power itself. So that's why myopic patient will face more and more difficulty at distance, right? Because the plus power is increased, right? And that the same myopic patient will feel ease at near object, while he or she is reading, while he or she is studying, while he or she is writing something at near object, that myopic patient will face easiness, right? He won't feel any difficulty at reading, and there is a logic behind that. And that logic is, that at near we need more and more plus power, right? So the plus power is already increased in case of myopia. So myopic patient will face no difficulty at near object, because the plus power is already increased in the case of myopia, in terms of myopia. So that's why myopic patient do not need any difficulty at reading. This is the first reason. And the second reason is called the far point. We have a detailed video on far point in different refractive errors. You can watch if you want. The link is in the description. You know, the far point is actually the farthest point in space where a person can see an object clearly, right? That point is called the far point. And you know that the far point in myopic patient, the far point of myopia is between the optical infinity and the eye. The far point of the far point of myopic patient is between both of these points, the optical infinity and the eye. The higher the myopia, the nearest the far point of the patient will be, right? So I must say, if you can see, if I have myopia of -1 diopter, then my far point would be at this point. If I have myopia of -2, then far point will be at this position. -3 here, -4, -5, -6. So the higher the myopic power of the myopic patient, the nearest the far point will be, right? So the far point is the point where a person can see clearly. So if I got myopia, then my far point would be near to the eye, so I can see my near object clearly. So that's why myopic patient will feel much more difficulty at distance, right? And he would be very comfortable, very easy to study, to write, or to read anything at the near object. Hope this is clear. We'll see you in the next video.